MedSynapse. I am your host, Dr. Simran Anand. And today, we continue our captivating exploration of the role of Gen AI in infertility management and pregnancy care. In our first episode, we delved into how AI is revolutionizing reproductive health. Today, we are joined again by Dr. Sudip Chowdhary, the visionary behind India's first AI-driven infertility ecosystem at Newbies. Today, we will explore ethical considerations, future trends, collaboration between AI and clinical expertise, and patient education in AI literacy. So let's dive in. Thank you, Dr. Chowdhary, and welcome back.
Hi Simran, thank you for bringing me back. Really a pleasure.
Thank you, sir. So, moving ahead with this, let's start with ethical considerations. What ethical considerations should doctors keep in mind with AI in reproductive health?
Okay, so I think as we discussed the last time, I think carrying on from there, medical ethics holds a huge part with AI-driven ecosystems, especially in medicine. Now, when you talk about reproductive health and fertility, I think ensuring patient understanding and consent in AI-driven reproductive health outcomes or platforms is actually the paramount importance. Now, but this will involve many steps, so I'll go step by step. The first step will be there should be a clear and transparent communication. That's very important, right? So you explain the role of AI, you clearly describe how AI is using the platform, including its benefits, limitations, and the type of data it uses. So you need to tell the patients what data we are using. Then about educational resources, you also provide easy to understand educational materials, infographics, FAQs about how the AI process and the reproductive system works together. Okay, so make it very lucid for people to understand. Second, take an informed consent, very important. So when you mean informed consent, it means you take a detailed consent forms. You use what we use with Newbies, we use comprehensive consent forms, a 3 or 4 page consent form, which details the use of the AI, data collection, data usage, and data sharing practices. So we share our data with other applications to let them know that. And obviously, it should be an interactive, constant process. It's not a one-way process, one-time process, because people need to forget that. So incorporate interactive elements like quizzes or videos. So in one part of the Newbie system, we have this concept called as Know Your Body. So what it means is, like, if a patient has PCOD, so the system captures PCOD's information, and through its LLM, it finds out information of PCODs and gives it to the patient as quizzes. So what happens is we have seen that it's an interactive learning. So if someone tells you about your disease, you are less likely to pick it up rather than if someone gives you as a quiz, interactive quiz. So in this way, through your right answers, wrong answers, you tend to pick up the information better. So incorporating interactive elements like quizzes or videos to ensure the user understanding is it's a cornerstone understanding, right? The second part is privacy and data security. Now, it is something which we need to talk about seriously. Now, what is all this thing? So data protection measures is very important. Like, we should implement robust data security measures to protect patient information, because patient confidentiality is the most important part, and we take it very seriously. Then we anonymize. So any personalized data is anonymized to us, because as you know, AI learns from the data you have given them. So if tomorrow I have your input, like Simran has a weight of XYZ, what it does is it anonymizes Simran. So next time it uses the data, Simran doesn't come in the preview. It comes as someone else. So it anonymizes the data. So our systems are anonymized completely. So your data, though used, because that's how AI learns, it doesn't carry your name. It doesn't carry your any of your credentials, right? Not your name, not your city, not your age. Right. Third is compliance with regulations. So regulations are there, like GDPR and HIPAA. I don't know if you've heard of them. So there are 2 important regulations. HIPAA is more of Indian, GDPR is more European. So we are stringent with the compliance of GDPR regulations and data protection laws. Audit trails, we do a lot of audit trails. Like, we maintain audit trails for all AI-driven decisions to ensure accountability, and most importantly, we have human oversight, which people forget, that a human being constantly is looking into what AI is doing, what information AI is giving people, and then corroborates it with, validates it with their data sets, and ensures that whatever AI is doing is right. It's a machine. It should be under you, not over you, right? So these are 5 steps.
So again, an insightful thing that obviously the audience will come to know from the things that you have shared regarding ethical considerations that one needs to take care when he or she is using AI specifically. So moving on to this, how do you ensure patient understanding and consent in AI-driven reproductive health interventions?
So I think when the patient onboards our system, they are taken through the entire process. So they have to go to 3 click points, which they can click and actually get the information. So if they tell you that we are going to delve into your personal information and take out your diagnosis, so there is a few 1 or 2 A4 size pages which we expect the patients to read, and if there is confusion, to come back to us because we have that option as well. So we don't allow you to sign without understanding, because until you go to the down of the page, you cannot click. So we made that thing, right? So yeah, that's one way to ensure. Second thing is through the entire journey, we have a lot of feedback loops where they are constantly asked questions that, do you have any concern about the data? Do you have any concern about the information you have got? Do you have any concern about the diagnosis or the plan you have been given? Or do you want to discuss with any human being, a psychologist or a nutritionist or a doctor? So you have that in various stages. So we have inbuilt those checks and balances to ensure that patients get a seamless information cycle.
That's really great. And now moving ahead with the future trends and research directions. So looking ahead, where do you see AI technology heading in reproductive health in the next decade?
So I think AI-based technology in reproductive health is poised to make a significant dent or significant advancement, I would say, rather disrupt the next generation, because whatever reproductive health now thing happens, it happens in silos. So it's like obstetricians working at one point, fertility experts working at one point, some nutritionists working at one point. I've seen a lot of social media posts with nutritionists talking about have chia seeds for breakfast is going to enhance egg quality. It doesn't work like that. So it can't work in silos. It has to be an integrated pathway, and that's what we're exactly making in movies. So I'll talk about personalized medicine, where we have a tailor-made treatment plans. So AI will enable highly personalized fertility treatment plans for couples, not only males and females, but couples together, based on the individual genetic, metabolic, and lifestyle data. So please understand these 3 things very clearly. So everyone has a particular genetic code which they cannot change, a particular metabolic code, and particular lifestyle code. I cannot tell you to copy my lifestyle, nor can you copy my lifestyle. You cannot do that. But then, having said that, it's very important to understand your lifestyle to make fertility options available for you. So we are going to personalize these things for you with these 3 things in mind: your genetic, your metabolic, and your lifestyle needs. Second is predictive analysis. What is predictive analysis? So it's all about understanding how things will be 6 months down the line. So if I'm smoking 15 cigarettes a day, I can predict that in the next few years, my sperm quality is going down the drain. So this is predictive analysis. So it is not like that no smoking sign in front of a cigarette packet. It isn't that obvious, very subtle, but it can predict with naturality. Second thing is early diagnosis and treatment, which we all are talking about. Like diagnostic tools are becoming better because the accuracy and the speed of diagnosing of certain issues like PCOD, endometriosis, and male infertility becomes immense. Next, biomarker identification. What is that? So advanced AI algorithms will identify new biomarkers. What we're seeing that early detection. So already for cancer is doing that. Early detection of fertility issues, potentially much before they manifest clinically. Okay, so that's something which we're doing. Third thing is enhanced patient support, and that's a cornerstone of what we do. So virtual health assistants, like OurB gives you 24/7 support wherever you are, answering questions, providing guidances, and monitoring treatment progress. So instead of you going, so it happens. So many people have told me at around 1 o'clock in the night, they remember that tomorrow or day after tomorrow is my ovulation day. Is this the best time to have sex for fertility? So the process for you to have, you just go to Google and search it. You get 15 answers. Some of them are blogs. You don't know how true they are. You go to the AI engine, which are all guided LLM, it gives you a straight diagnosis, straight story that yes, 24 hours around ovulation, highest chance of fertility is there. This is the time for you. Go for it. So, virtual health assistant, mental health integration, very important. So, what we mean is that till now, mental health was considered as again working aside. So, you are undergoing a fertility treatment, you are anxious, you're depressed, you are told, why don't you visit a psychologist? You're already like drained with money, you're already drained with time. You actually don't have time to go to a psychologist, rather you don't have the money to go to a psychologist. They will charge you like 3,000 rupees every hour. So our system, which is part of this entire, I'm sure better system will come out, where we are, you're actually talking to your camera, and through your face and through your words, your language, your sentiment, we're analyzing that what your psychology is going through, and we can give you very good insights from that. At least it can be a bridge till you actually find time in the money to go to a psychologist. We're not telling you this against psychologists, but this is a bridge till you go to a psychologist. So at least give you something, right? So obviously, in this way, you're enhancing patient support, which I believe is the most important part of first-century medicine. Lastly, I would say optimize treatment protocols, because protocols are something which people follow or don't follow depending on the country or geography they're in. But with AI-based algorithms, protocols have become far more easier to follow and also personalized. Like obviously, UK-based protocol may not be useful in India, but then with the data sets, AI can actually make India-based protocols, and they may be used as well. So yeah, so I think these are the few things to check.
So that is more of like incorporating all the departments together and again giving a holistic approach to the patient, so that patient feels secure, and it is like it's a complete thing that the future actually you are doing it, but the future might bring it even more better by enhancing all of these technologies that we are having right now. So collaboration between AI and clinical expertise. Since in the last episode we were talking about this, that the doctor's acceptance is not that great, or maybe 50% may accept it, but some of the people still think that AI is not that, I should say it should not be included, or they are hesitating in including that in their clinical practices. So how can doctors effectively collaborate with AI to enhance reproductive health care?
Okay, so I think this boils down to the same question we discussed last time, that we as doctors need to be very wary about, rather not be afraid of AI, rather try and take that as a friend, because AI is there to help you, not work against you. So AI is those things which you are missing, which you don't want to miss. So AI is your like the constant friend who's sitting beside you, who's trying to help you, who's prompting you when you're missing something. I would have loved a friend like that. Imagine you writing an exam, you're forgetting an answer, someone tells you, oh, Simran, the answer is this. And you just say, right, you would have thanked him, right? So you would have thought that, oh my God, he's my competitor. No, he's your friend. So I think collaboration between AI and medicine is immense. Again, it boils on the fact that how you want to view it as. I view it as a friend. And as long as I view it as a friend, I know it's not going to get on me. Yes. So I need to know its bounds, its limitations, and obviously it's the things which make it easier for me to use. And obviously it's going through constant changes. In the future, I think doctors need to work much more closely with AI-based technologies, because that is the only way forward. Like at 1970s and 80s, you couldn't work without computers. If someone thought that I cannot work without a computer, it's madness. You have to work with computers. There's no other option. You have to work with AI. There's no other option. So either you fit in or you fit out. That's it.
Okay, so that was a really well-framed answer that a doctor can actually, it will help them to adopt this, because as you rightly stated with the example that it's a friend who is helping you while writing an exam, so we can consider it the same way while diagnosing or maybe while planning treatments for the patients. So it is completely like taking it as, the best out of it. So,
Yeah.
as you rightly, actually, you have mentioned in the previous podcast as well, the better you give it, the better you will get out of it. So, the
Yes.
prompts that we give, it's most important. So, it was really, again, like, I should say that I really would want to adopt AI if in case I do a diagnosis, or if in case I plan a treatment, definitely, so that I don't miss out to anything. So, that's
Yes.
really
See, the
like
ultimate
nice.
aim is to make the best the patient, right? The patient is the first. He's the center of your entire society. So when you say patient first, it means the patient is in center, patient centric. When patient centricity comes, I don't think any ego stays there. As long as you are getting the best diagnosis, and I always believe a hybrid approach is the best. In hybrid approach, what happens is the doctor and the machine work together to give the best results. So I was in this IVF conference last week, and they were talking about blastocyst selection. So what happens is in IVF, they have this concept of blastocyst selection where after a sperm and ova have mated together, and they actually take out the best embryos out of it to actually put it back into the mother. So the embryologists tend to do it where they choose the blastocyst, find which is the most potent. So now AI technologies are being used for that, and because of AI, the chances that you have selected the best processes has gone up by more than 200. So that's what it is. So the mistakes which human beings could do because of a limited understanding of certain things, because of data and AI powered algorithms, I think many of that things are becoming easier to do now. So yeah, it's time to embrace the technology wholeheartedly.
Definitely. So, how important is patient understanding of AI in their reproductive health journey?
Okay, so I think again this comes about again those informed consent where you give the transparency, trust building, and the trust building is very important for patients because see, as human doctors, we understood that trust comes late. Once a patient visits you, twice a patient, you are a doctor yourself, so you understand that the first time a patient comes to you, they can come to you simply, obviously knowing that you're a big name, you're very famous, and obviously things will work for you. But it's a very personalized place, isn't it? If it is work for X, it may not work for Y. So I think for every patient, trust is very important, and trust doesn't come in the first visit; it comes after many visits. Similarly, for AI, I'm not expecting any patient to trust AI blindly, and that's the reason why a human interface is required here. A hybrid system is required. If I had left the entire system to AI and I had asked people to come in on board, get everything done by AI, it won't run a day because patients are not going to believe what a machine tells them. There has to be a human interface who's going to tell them that whatever they have said or done is right, we may go for it. Again, same for psychology, same for nutrition. Yeah. So I'm sure there's no mad person in this world who will believe what a chatbot has told them and actually not go to a doctor after that. They would definitely go to a doctor. So I think trust building will take time, but I'm sure, like as now people believe Google more than doctors, so there's a huge amount of confusion because a lot of people do a lot of Googling before they visit doctors and actually take many of it directly to the heart and come and cross question the doctor about what the Google has said, thinking that Google probably knows it better. I'm sure that this has not come overnight. It's come through 10 solid years of Google's presence there. With AI, it will take much lesser time, but obviously it will take time. You can't expect them to be very sure about AI the first day. So yeah, so trust building is important. Transparency is very important. I think everyone who's using LLM-based AI technology needs to tell patients what to expect, what not to expect. So from day one, transparency relationship is very important. Third thing is, again, empowering patients through knowledge and control. So the patient should have control about what exact information they want out of it. It's not that you given some information and you get all the information of this world. Information overload you don't want. Okay, they should be able to garner engagement through proper prompts. And the system should be designed in that way. Again, AI should be helping patients in decision making, not making decisions for them. So when I'm a patient, I want to make a decision. So AI shouldn't be making a decision for them. They should be giving them, there are like 3 or 4 options for you. Option A is this, option B is this, option C is this. You decide now what is better for you. Again, through that decision, again the AI is going to learn further. So see, it is that loop. Again, improving the outcomes, educated patients, again, as I said, are more likely to engage with AI tools and follow recommendations, which can improve health outcomes. And again, adherence to this plans can have better improvement of patients' therapies and lifestyles. As I said, AI is an ever-improving loop. So once it does something better and gets a good thumbs up for it, it does it even better next time. So that's the great thing about AI. So if it does something bad and you're given a thumbs down, next time it tends not to be the mistake. But that's the loop through which it's made. So it is, that part of it is really, really human like. We as humans would not like to repeat mistakes. AI hates repeating mistakes. It doesn't repeat mistakes. So I remember one time when I had used ChatGPT and I had put my name and they were not sure it was a boy or a girl. He addressed me, the AI system addressed me with she. And next time I told them, Sudip Chowdhary is a boy, is a man. From then on, it never made the mistake. It just gets in the memory. So similar thing it will happen with patients as well. A lot of anxiety and fear can be reduced through simple algorithms where people can ask questions. There should be more confidence in technology which people need, and I'm sure it will happen with time. But again, ethical and legal considerations, we remember that. Proper patient understanding will ensure compliance with ethical and legal standards regarding AI use in healthcare. So these things should be very clear. And patient rights is obviously something I will talk about. Educated patients are obviously in a much better position to exercise their rights regarding data policy and usage. My worry is, because India has a huge uneducated mass, I don't want some companies to use AI to take their data away from them and they have no clue that the data has gone from them. So that is the only flip side with which AI can be used in a country like India where there's a huge amount of uneducated people. So that is something which the lawmakers have to work on, ensuring that some form of guard is given to them as well.
So, what strategies can doctors use to educate patients? As you mentioned earlier, like through your application or through various kind of like podcast, or maybe using any kind of like written evidences or anything that is actually legitimate for the patient to understand things. So what strategies exactly do you follow to educate your patients about AI in infertility and pregnancy care?
See, I think it's very important to have credible applications or credible systems which doctors can believe in. Obviously, if I believe in, I can forward to my patient to see. And the reason why we are collaborating with numerous IVF centers and hospitals, letting ourselves know and let the doctors check for themselves how our system works and how credible information is. So once that is there, the doctor himself or herself believes that the information which newbies is giving or any other person is giving is credible, they can pass that on to the patients. Because I think patients look up to doctors to give them credible information.
Yes.
And I, as a doctor, if I recommend them an application, I myself need to be very clear that this information being given by this application is credible as well. So I think any such organization like us, any such digital platform needs to make themselves transparent to the healthcare providers and actually tell them to review it, to use it multiple times before actually referring them to the patients. And I think that's safe in both ways. So I really ask doctors to come to a platform, observe it, read it, behave as if you're a patient, and then see the information is credible or not. If there is not, then let the owners know, let the founders know, let the tech team know where things have gone wrong. And I'm sure such feedback loops exist. And obviously, if things are fine, then obviously go take the extra step and let people know that there is a system which gives you credible answers, which gives you this. And I think it's good because I have myself used it. It's simple.
So actually, we are about to end this session because this is all that I wanted to ask you regarding the AI and its role in infertility management and pregnancy. But it was really a session that everyone would listen and incorporate something from that so that they can actually change the patient's life, because everything is linked to a new life that is being born. Obviously every parent or every woman or man out there needs certain kind of things that you have established over the period of time so that they can open up and they can express their fears without any sort of hesitation, or maybe they feel like they are underprivileged, or maybe you might judge them, the doctor might judge them. So this is actually breaking all the walls and then helping the patients so that a better treatment outcome can be made out of it. So really it was an insightful session for the doctors as well, so that they can incorporate this, and leading the only aim is to give better treatment outcomes and better patients and happy smiles whenever they see certain things happening in their life, because becoming a mother or becoming a father is a big thing in someone's life, and you are actually giving that in a perfect way. So patients' blessings do work, and this is how the healthcare system is working over the years. So thank you so much, doctor. It was really I should say enlightening session with you, as well as it will continue with the next few more episodes talking more about all of these things. And thank you all for tuning into today's episode of MedSynapse. We hope you found our discussions on the role of GenAI in infertility and pregnancy care both insightful and inspiring. Thank you, Dr. Chowdhary, so much for actually joining us today and sharing your invaluable insights on the role of GenAI in fertility management and pregnancy care. Your expertise and dedication to advancing reproductive health are truly inspiring. We greatly appreciate your time and look forward to continuing such important topics in future episodes as well. And if you are a medical professional with valuable insights or an intriguing case study to share, we warmly invite you to connect with us. Your expertise could be featured in an upcoming episode, contributing to our collective knowledge and progress. Until next time, keep pushing the boundaries of healthcare and stay tuned for more engaging discussions right here on MedSynapse. Thank you.